RMS Medical Products introduces RES-Q-VAC, handheld medical suction.
RES-Q-VAC is a portable, hand-powered emergency suctioning device consisting of a reusable vacuum pump handle and disposable fluid capture canisters with full-stop protection. A wide variety of sterile and non-sterile whistle-tip catheters are then attached to the canisters based on patient size. In addition to these supplies, RES-Q-VAC also provides optional features such as an LED light attachment, endotracheal adapter, and convenient, highly visible carry bag. RES-Q-VAC handheld emergency suction is used to suction fluids from the nose and throat. Typically, 8 and 10 French catheters are used to suction infants and small children. 14 French catheters, soft and rigid Yankauers, are used to suction larger children and adults.
RES-Q-VAC is extremely easy to assemble and use. It's as easy as 1, 2, 3. First, snap the canister into the vacuum pump handle. Then, squeeze the handle to suction. The faster you squeeze the handle, the faster you'll suction.
Now, try it for yourself. Snap the canister into the vacuum pump handle. Squeeze the handle to suction. Place the catheter below the fluid level. The faster you squeeze the handle, the faster you'll suction. Now that you have the basics, let's talk specifics. After this presentation, you will learn how to test, assemble, and use the RES-Q-VAC, what to do if an obstruction occurs, pediatric and adult suctioning, how to suction down an endotracheal tube. You will also learn about our full-stop protection filter and why it is important.
To test the pump, remove the canister and adapter by grasping hold of the adapter's arms and gently pulling forward, as shown here. Assure that the large umbrella valve is in place and suction while placing your index finger over the vacuum port. As you squeeze the handle, a vacuum should be felt and the handle becomes difficult to squeeze.
Now that you've tested the pump handle, insert the canister assembly into the pump by snapping the adapter nozzle into the vacuum port. Determine the size of the patient and select the appropriate size catheter. Remove catheter from package and gently push the catheter lower onto the cap fitting.
When attaching the soft Yankauer, make sure that the catheter is at a 45-degree angle.
Introduce the catheter into the patient's airway and squeeze the handle to suction. Preferred technique is to suction while withdrawing the catheter, but always refer to your local protocol when suctioning. If during suctioning you feel that the handle becomes difficult to squeeze, an obstruction may have occurred. If you know that it is a foreign object blocking the catheter, continue suctioning until the obstruction passes through the catheter into the canister. If you are unaware what is causing the blockage and believe it may be tissue, you must first break the vacuum by gently grasping hold of the adapter's arms and removing the canister assembly from the pump handle. The catheter can now be safely removed from the patient. Then, once the catheter tip is clear, reattach the canister assembly to the pump handle and continue the suction procedure.
After use, dispose of the canister, adapter, and any used catheters. Do not dispose of the vacuum pump handle. The vacuum pump handle is safely reusable and can be wiped down after each use with a neutral pH cleaner, non-alcohol.
If for any reason the unit does not produce a vacuum, check that the large umbrella valve is in place. Assure that it is not ripped, torn, or folded. If you need to adjust the umbrella valve, use your index finger and position it until it lies flat, completely covering the umbrella port. Make sure the canister cap is tightly screwed onto the canister and that the plug on top of the cap is fully inserted.
Remember, you have to remove both the canister and adapter from the pump handle in order to reach the umbrella valve. As you can see, this umbrella valve is folded and therefore will not produce a vacuum. To restore suction, fix the umbrella until it lies flat, completely covering the umbrella port.
Standard suction procedure is to place the catheter below fluid level and suction while withdrawing the catheter. The faster you squeeze the handle, the faster you'll suction, and the higher the vacuum level that will be generated. All of our catheters have multiple port whistle tips and will not block off during routine suctioning. With our pediatric catheters, you can perform full nasal and oral suctioning. To use the RES-Q-VAC on pediatrics, select the appropriate size catheter for infant or child. Again, all catheters are whistle-tipped and will not block off during suctioning. Place the catheter below fluid level and squeeze the handle while withdrawing the catheter. Squeeze the handle as necessary to reach the suction level required. You have full tactile feedback, which means you will be able to feel what suction level you are at by applying force to the pump handle.
To suction down an endotracheal tube, attach a 14-inch catheter to the RES-Q-VAC and insert this catheter directly into the endotracheal tube. Perform the standard suction procedure. It is highly recommended that each RES-Q-VAC kit contain our patented full-stop protection filter. This filter is equivalent to a .22 micron filter and blocks all pathogens and fluids from exiting the canister. It also provides full protection from the possibility of spreading infectious diseases such as HIV, AIDS, hepatitis, and tuberculosis. When using the FSP filter, remember a few special precautions. It is best to maintain a semi-vertical position when suctioning. Avoid use in the upside-down position. Doing so can prematurely flood the filter, causing it to block off before you've completed suctioning. In the event that the FSP filter does become blocked off, you will need to have another canister available to finish the procedure. Once the filter is blocked off, you will no longer be able to suction with that canister.
An optional feature to the RES-Q-VAC unit is our patented, fully malleable LED light source. This LED light simply clips on to the top of the unit or any place you need it to provide light in an area of darkness.
To attach the LED light source, insert the light into the adapter as shown here. Make sure it is secure. To turn the light on, move the top switch forward.
Specifications and performance. RES-Q-VAC's vacuum reaches the same level as wall suction units. It is lightweight, portable, and can go wherever you need it. Remember, RES-Q-VAC is extremely easy to use. Just snap the canister into the pump and squeeze the handle to suction. The faster you squeeze the handle, the faster you'll suction. FSP prevents all infectious disease and contamination. It is safe, portable, and easy to use.